How can drugs be abused? What are the symptoms to know when someone is addicted to drugs? A drug is any substance, with the exception of food and water, which when taken into the body alters the body function. Now, there are two divisions of drugs. We have the illegal drugs and the legal drugs. Understand? Illegal drugs are drugs such as cannabis, cocaine, heroin, and the so-called umbulumiri, which all of us here know. Now, let me give you examples of the legal drugs: caffeine and tobacco. You can find caffeine in coffees. You hear with me? It's there in Liptons. These are legal drugs in a way that have its own purposes. Like I said earlier, we have illegal drugs and legal drugs. We have illegal drugs such as cocaine, heroin, and marijuana. All these drugs are inhalants. These drugs, the reason why we call them illegal is because they are not being prescribed. These are drugs that you can just go somewhere, get them, and just take them for the aim of just being high. Maybe to just satisfy your emotions or to escape from reality. Are you with me? Now we also have misusing prescription medicines, using opioids. Okay, opioids are drugs that doctor prescribes, like pain relief, you know. Then taking a larger dose than you are supposed to. Most of us, when the doctor or the nurse prescribes vitamin C to you, you just take the first one, take the second one till you finish the whole card. No, it's not proper. We also have using the medicine in a different way as expected. For example, instead of swallowing your tablets, you might crush them and then snort them or inject them. Some of us, maybe when we go to the clinic, nurse gives us drugs. Instead of drinking it, maybe you feel that the drugs in a way will make you high, will make you just want to forget your sorrows, because these are one of the main reasons that make people take drugs. Maybe you just break it into pieces and then sniff it. You know, it's not proper. It will affect your mental well-being. As a student, we all here are aspiring to be greater people in life. So when you come across drugs as a whole, we need to be very, very careful, because its effect, negative effect alone, is enough to end all our dreams. As I said earlier, it will end all your dreams, no matter the drugs. Now, let me play this video. You know, you might be hearing names of different drugs, you keep hearing names, but you don't really know what it looks like. So, what you saw now is an example of how the methamphetamine, umbulumiri, looks like. At times, many people might just use it in cracking jokes. Many people take it in the streets. Many people take it different places. You know? So it's better that you know it and know how it looks like. And its negative effects are very, not, in fact, not curable. If you start it, you will keep slimming down. As a student, you can't focus. You can't read. You'll be feeling lousy. You can't meet up with expectations on your academics. Drug addiction in general, as I earlier said, there are different drugs. There are different drugs with its own prescriptions. Not everyone who takes normal drugs gets addicted. It might be due to your environment. Maybe you have peers that take the drugs, and then it's because you are close to them and I don't want to fall your hands. You just want to take it so that everyone will be like, yes, he's among us, yeah, he's with us. But in the real sense, you are destroying yourself. As students growing up, your aspirations are high. Maybe tomorrow you want to be working in a big company, doing well, but once you jam these drugs, no matter how small it is, it can destroy you. Let's look at the causes of drug addiction. Number one, we have loneliness, family history, peer pressure, escape from emotional pain, prescription drugs, recreation, experimentation, stress, trauma, and pain from physical injury. We also have escape from reality. Now, let me start with loneliness. You might just go home during the break. Maybe you're in the house, you don't have anywhere going. And then, be like you have neighbors over there at home that do take these drugs. Or maybe you just don't have anything to do, because an idle mindset is devil workshop. Because when you are idle, not doing anything, you want to explore what you haven't tried, and you want to do what others are doing that you are not doing. That's the cause of taking drugs as a result of loneliness. Many other factors can be there. You might just be alone. A friend of yours will just come with the drugs, say, oh boy, take, move, chill, just do all right. You're with me. So then we already have family history. Family history. What I'm trying to tell you now is the causes of drug addiction. Your family member, be it your dad, your brother, your sister, might be a drug addict. And then you might want to join him because you feel that he's a family member and there's nothing in it. You should rather advise the person. Try your best to advise the person and move out from friends or family members you know that might influence you. Then we also have peer pressure. This is still what I'm saying about friends. The good friends, the bad friends, negative effects, positive effects. You may have a group of friends that might like alcohol. You take alcohol, you just want to get high. You just get things just to get high, just to escape from reality. You know, maybe you're suffering from pain or something. Then you take these drugs. Maybe your friend give you the drug, take, you go do all right. All that kind of stuff. It's not proper. As someone that's growing up, you need positive friends, positive peers around you to encourage you, to tell you do this that is right and not do this that is wrong. Then let's talk about the prescription drugs. Prescription drugs are drugs that the doctors will recommend to you and tell you, take this to heal yourself or take this for so whatever it is, but it's a prescription for the doctor. But when you abuse those prescriptions, when you just take the drugs for fun, you know, all these drugs that like 50 milligram, 500 milligram, that's when you take it, you just sleep off, or when you take it, you just be feeling, if you have an internal joy, just to pass time, you just want to feel all right. But all these drugs have negative effects, you know. Then we have recreational experimentation. I've said that before. They have pain from physical injury. You have escape from reality. Maybe you just want to take drugs, like I said before, just to escape what is happening around you. Maybe a family friend died or something, and then you'll be like, you've cried, or you've done this, or you failed in exams. It's not the end. That failed an exam is a room for you to improve. You know, it doesn't really give you an insight to take drugs, because taking these drugs won't give you anything. Rather, it will cause you more harm. These drugs have many harmful effects, even on the nose. Like you might just stay sitting down, blood starts rushing down your nose all of a sudden. As well as slurred speech. When you are talking, your voice is very hard. You know, then we have the bone marrow. When you take all these drugs, it enters into your body. The body absorbs them. You know, it absorbs them and makes you to do things that ordinarily you can't do. Then abdominal pain, hearing loss. You may not be able to hear very well anymore. Even as a student, you know, when you start taking all these things, it destroys your organs. So that's the main reason why I said earlier that once you start taking drugs as a youth, it will destroy your career. It will destroy whatever goal you have achieved. What are the signs that someone has a drug problem? This is a question that you ask yourself. If a drug addict changed lots of friends, he spent a lot of time at home, losing interest in favorite things. Because obviously, if you make a friend that's a drug addict, he will influence you and must influence you in the negative way. Not taking care of themselves, for example, not taking showers, not changing clothes, or even brushing their teeth. They don't even care. You know? Now, being really tired and sad, eating more or less than usual. Because all these drugs have its own side effects. You might finish smoking or sniffing or injecting drugs in your body, like drug addicts. The later effects, hunger, different is just one of the negative side effects, of which I'll never advise any student or advise anyone that these are drugs, you should avoid them. No matter what it is. That's why I said, even if it is a doctor that is prescribing a drug for you, you need to be very, very careful with that drug because it can destroy your life. You take it according to the prescription. Now, I also have been in a bad mood, sleeping at strange hours, having problems at work or school. When you start taking these drugs, you won't be focused anymore. You can't concentrate. Others will be going to class, you hide and stay back in the hostel to sleep. Why? Because there is something that is causing your reactions, that is changing your character in a way to comport to the way you think, you feel that you expected to be. It's not proper. Now, we also have the treatment for drug addiction. Necessarily, drug addiction in general doesn't have any treatment unless you are being taken to the rehabilitation center, which in a way is not a treatment. The treatment is finding out what your problem is and knowing how to cure it. That you take drugs now doesn't mean that you can stop. You can stop. Like what Tyler said, can drug use and addiction be prevented? The answer is yes. The answer is yes. Because for you to help yourself alone, to prevent these drugs and its abuse alone, is that you've come a very long way already in developing yourself, in abstaining from it, in drawing yourself far away from it. So when you meet friends, you socialize with positive people and not the negative people, because they will help you, enable you. You talk to them, tell them your problems, and then they will advise you on what and what not to do. If it's to avoid some certain friends, you avoid them. If it's to change environment, you change environment, so that if there are things that you have been doing, it might enable you to stop doing them. So at this point, I will come to the end of this talk.